Okay, knock knock. Hi, Mrs. Smith. I'm here to just empty your catheter. Is that okay? Is it a good time? Okay, great. Well, you know I'm Nikki. I'm your student nurse aide, and I'll get started. First, I'm going to wash my hands, and then I'm going to grab my barrier here and lay it down here on the floor. And just for demonstration purposes, we're going to leave the bed low because I want to show you how you can do this, because there are some beds that are on the floor, and in an ideal world you will want to bring this bed all the way up, and so you can drain it properly. But for, like I said, for demonstration purposes, what if there are beds that are on the floor? How do you prevent cross-contaminating the graduate cylinder with the spout? So let me grab my gloves. And I'm going to wash my hands before I put on gloves. I'm going to pull my curtain. Your bed is low, in a low position, and your call light's within reach. I'm going to grab my graduate. My graduate cylinder here is in increments of 25. So like here you see 50, the next line would be 75, the next line is 100, 125, 150, 175. If you happen to get the urine and it's in between, let's just say it's in between 100 and 125, you need to round up to 125. Okay? So if it's in between, you always round up. The other thing, we're going to keep the nozzle from hitting the edge of this, and here's our barrier. I also like to grab a paper towel, and I'll put this underneath my cup. Okay, so the first thing, the catheter bags have a housing, and it also has, it's numbered as well, but the bags are not as stable. You don't want to read the input from the bag. You want to read it from the graduate cylinder. So we're going to pull this out of its housing. Here's just one type of bag. There are many types of bags. And then you also don't want to point this by your eyes, because it's just like a gas. You know, you don't want to put that in your eyes. So we're going to open that up. There's a little clamp here, and we're going to pour this in as such. And what I'm doing is lifting, as you can see. So this bed is to the floor, but I'm still able to drain the drainage bag because I'm just kind of lifting it up. And I have to be mindful not to raise the bag higher than the hips or the bladder, because then all of this urine that's been sitting here for quite some time will go back into the bladder, and then, you know, you have a risk of UTI, urinary tract infection, which just means that infection penetrated the bladder, and we don't want that to happen. So now we're going to clamp that. Now, there are some facilities that will require you to get an alcohol pad, in which I will get right now. And clean the nozzle like this. Just clean the area like that. Okay? And then after we clean it, we're going to make sure it's clamped, because there's nothing like urine on the floor. Not only can you slip, the patient can slip on it. And now I'm going to take my towel, my barrier. I'm putting my barrier in the dirty clothes, bringing my other barrier over here, because I need one to set it down on a flat surface, like that. Put my alcohol pad in the trash. Now I'm going to get down to eye level. And if you can see that is right in between. It's above the 350 and close to the 375. So guess what we're going to do? You got it right. You're going to round up. So we're looking at 375. So I'm going to still have my gloves on. I'm going to come to the toilet here. I'm going to pour this out, being mindful again not to touch the toilet, not to touch the lid. Also pour away from you. Always pour away from you. You don't want anything splashed in your face. A lot of times you will have to use a face shield. It depends on the situation of the patient, if they do have an infection. Dry. And the nursing homes or real facilities, you really want to use soap and water to get the urine out, prevent foul odors. Now I'm going to take off my gloves. Okay, so the way we do that is I do this duck, duck, quack, quack thing. So this is a duck. I'm going to quack. I'm going to pull on the other one, and I'm going to pull it off like this. I'm going to make it disappear. I'm going to eat up the other glove. It's in my hand. Then I'm going to take my fingers, go underneath, and I'm going to pull this over. Now here's the kicker. This is where people go wrong. They take the glove off this way when you're touching the outside of the glove. Now you're contaminated again. So no, you need to take them off by the fingertips here, like that. Drop them. Always wash your hands after you're done. After you're done with that, there will be a form on the table that will have a little line and for your signature, and also a little space for you to put your measurement, which you would wash your hands, grab the pen, and put 375 cc's. You could say cc's or ml's. Cc's and ml's are the same. And then after that, you say your skill is complete.